When a patient is referred to another healthcare provider, what is the purpose of electronic referrals? Meaning like the provider that the patient is seeing now is putting a referral into the computer to the second provider to refer this patient to the specialty practice or some other provider. So option A says to provide the patient with a list of potential providers, and that wouldn't be the purpose of the electronic referral. So the provider might give the patient a list so they could have an idea of who to see, possibly specifically providers within network for a specific specialty, but that wouldn't be the purpose of an electronic referral, which is referring the patient through the healthcare system in the computer to the other provider, so the other provider has the information. So therefore, we could eliminate option A. Option B says to schedule the patient's appointment with the referred provider, and the purpose of the referral is not to schedule the appointment itself, it's to provide that continuity to the next provider. So we could eliminate option B. Option C says to confirm the patient's insurance coverage with the referred provider, and that would be something that would be done with like billing and would involve possibly prior authorizations depending on what needs to be covered. So no, that wouldn't have to do with the insurance coverage. That would be a separate area. And then option D says to ensure the referred provider has all the necessary patient information for the visit. And that makes sense because if we're referring electronically, that means that the referring provider could have access to the patient chart and it could just help create a seamless transition. So we will go with option D in this scenario.